Thank you all for listening to my presentation. I'm here to talk to you about the 40-second indicator on the National Scoreboard on U.S. Health System Performance, the use of electronic records. According to Estes et al., the proportion of primary care physician practices that use EMR systems increased from 17% in 2000 to 46% in 2009. That itself is a vast improvement, but sadly still leaves our ratio of U.S. to benchmark at 34%. We still lag significantly behind the UK, Australia, and New Zealand, where nearly all their physicians now use EMRs. Why the delay? Rationale for delayed implementation comes from many angles. One is high financial costs. Especially in smaller practices, PCPs believe there is too much upfront cost and the loss of productivity in the implementation period for the EMR to be successful. Physicians were also concerned for uncertain payoffs and the available technology. Again, especially in smaller practices, doctors were concerned of the change itself and were resistant to it. Practice size does seem to be a main variable. Yan et al. Looked at thousands of providers in Rhode Island and discovered resistance to EMR implementation was indirectly correlated with practice size. Hospitals were the majority of those that accepted it, while smaller practices less likely. In 2009, President Obama signed into law the Health Information and Technology for Economic Clinical Health Act, or the HITECH Act. It was a large reason for the growth of EMR in 2009. It helped distribute billions of dollars to doctors as incentives to start using EMRs. So yes, the HITECH Act was a huge milestone, but today these initiatives have already expired. More needs to be done to continue and unify our country. We need to give its people the best possible health care and have their records accessible to providers that need it. Let's look at quality indicators. When the HITECH Act was passed, if a provider wanted to receive a grant, they must meet 14 out of 15 core set objectives. This is how the Department of Human Health Services determines the quality of the EMR usage, and they use the term meaningful usage. The list of core set objectives is as follows. 1. Computerized provider order entry, or CPOE. 2. E-prescribe. 3. Report ambulatory clinical quality measures to Centers for Medicare and Medicaid Services. 4. Implement one clinical decision support rule. 5. Provide patients with an electronic copy of their health information upon request. 6. Provide clinical summaries for patients for each office visit. 7. Drug and drug allergy interaction checks. 8. Record demographics. 9. Maintain an up-to-date problem list of current and active diagnoses. 10. Maintain active medication lists. 11. Maintain active medication allergy lists. 12. Record and chart changes in vital signs. 13. Record smoking status for patients 13 years or older. 14. Capability to exchange key clinical information among providers of care and patient-authorized entities electronically. And last, 15. Protect electronic health information. When you vote to pass further acts and programs to improve our country's access to electronic medical records, please keep these core set objectives in your mind. Without EMR, citizens' health information can be lost or made inaccurate. We would measure the outcomes of future programs by looking at the percentage of practices and physicians that have access to EMR. We would also do a cost-benefit analysis which monitors the cost of charting and monitoring the reduction of charting redundancies and errors now that an EMR is in place. We should institute a national policy. A doctor in California should be able to access records in New York. There needs to be a reduction in accurate and incomplete medical records that can lead to fatal errors in treatment. I am asking U.S. Congress to please continue offering initiatives to all practices, especially privately owned ones, and keep initiatives going for larger users such as hospitals, and offer grants to their research departments that use EMRs for data collection. Thank you for your time and looking to help keep America healthy.